Okay, good afternoon, colleagues. Good afternoon, everyone. Welcome to another Southern Africa RCC Eco Session. And for today's Eco Session is a special Eco Session for the fact that we have a guest presenter who will be presenting on the Africa CDC framework for One Health practice in NPHIs. And the good thing about it, that person is also the AMR program coordinator for Africa CDC. We all know that currently Africa CDC will be launching the World Antimicrobial Awareness Week campaign starting next week, and the theme for this year is handle antimicrobials with care. The campaign will be running from the 18th to the 24th of November. And the time for presentations will be from 9 o'clock to 12 o'clock in the morning, Southern African time. Therefore, this presentation come at a very right time for the fact that most of our AMR focal points are as well invited to attend this meeting, and also other key players in the AMR field. Because when you looked at the when you looked at the trajectory of the of our various Ministry of Health, people are more focused on human health. So it means that there's no level playing field for our animal health colleagues. So for that being the case, because we all know that animal health is a very important pillar as far as health is concerned. These animals, we live with them, of course, and we also eat them as our food. So therefore, the health of these animals should be as much a concern to us our own health as human beings. Without wasting much time, we can start with the introduction of participants. For the introduction, you can say your name, which country and organization you are representing. So I will start with myself. I am Yaya Kande, Public Health Fellow with the Southern Africa RCC. So we have Chika.
Good afternoon, colleagues. My name is Chika, epidemiologist working with Africa CDC.
Okay, we have Andiswa. Andiswa, can you hear us? Okay, it seems he was, okay. Andiswa, we can't hear you. Okay, we can move to the next one, Loveness.
Good afternoon, everyone. My name is Loveness Monde from Zambia, Ministry of Health, currently involved as a Africa CDC volunteer based at Kazungula Point of Entry.
Thank you very much, Loveness. We have Dr. Togmo. Dr. Marota, can you hear us? Can we have Eta Haludilu?
Good afternoon, everyone. My name is Erta Haludilu, Namibia Field Epidemiology. I'm one of the CDC volunteers.
Thank you very much for joining us this afternoon, Eta. We have we have John Simwanga.
Good afternoon, everyone. I'm John Simwanza, field epidemiologist based in Zambia.
Thank you very much for joining us this afternoon, John. We have Luito.
Good afternoon, everyone. I'm Luito Mtale, Zambian. I'm one of the Africa CDC volunteers based in Kasumbalesa.
Thank you very much, Luito. We have Olivia.
Yes, good afternoon, everyone. My name is Olivia Nakwafila. I'm one of the Namibian volunteers.
Okay, welcome, Olivia, for joining us this afternoon. We have Paida.
Good afternoon, everyone. My name is Paida. I'm also one of the Africa CDC volunteers based in Namibia. Thank you.
Okay, welcome. We have Dr. Ochuros. Dr. Philomena, can you hear us? Okay, we can move to Uzenia. Uzenia, can you hear us? Okay, then we can move to Dr. Watipaso. Watipaso, can you hear us? Okay.
Yes, I can hear you. I can.
Okay. Can you introduce yourself?
I am Dr. Wati from Watipaso Gasambara from Malawi. Today coming in through as AMR coordinator for Malawi Ministry of Health.
Okay, welcome, Dr. Watipaso. So now I will allow our director to introduce a coordinator to introduce himself. Then he can also say a few words before we can introduce and welcome Dr. Wande. Dr. Lul, over to you, sir.
Good afternoon, ladies and gentlemen, dear colleagues. My name is Dr. Lul Wick. I serve as RCC coordinator for Southern Africa. So thank you. Let's hope we will enjoy these important presentations and reflective in our own health policies. Thank you.
Thank you very much, Dr. Lul. So our special guest today is Dr. Wande Alimi. Alimi, who is the program coordinator for Africa CDC, sitting in Addis Ababa in Ethiopia. So Dr. Wande will be the one who's taking us through our presentation on the Africa CDC framework for One Health. So Dr. Wande, you can introduce yourself. Then from there we can have Dr. Chika, who will give us the epidemiological update of the region. Then from there, Dr. Wande can kickstart with her presentation. Welcome, Dr. Wande.
Thank you so much, Yaya. Good afternoon, colleagues on the call. It's a pleasure to join you on this special RCC Echo session. My name is Dr. Yewande Alimi. As Yaya already did some sort of introduction for me, I'm the program coordinator for the antimicrobial resistance program at Africa CDC. And as part of the work I do, I also coordinate some of our One Health activities, which I will be talking about later today in the session. So thank you so much for having me.
Yeah, Dr. Wande, we are actually so excited to have you on today's session. So without wasting much ado, I can hand the baton to Chika, who will take us through the epidemiological situation for the region this afternoon. Chika, welcome. Over to you.
Okay. Please, can you hear me? Hello?
Yes, we can hear you.
Okay, thank you very much. Just wanted to confirm that. And please, are you able to see my screen?
Yes.
Yes.
Okay. So good afternoon, all. I'll be presenting the epidemiological situation as of 11th of November 2020. Here is the global epidemiological situation of COVID-19 update as of 5:22 p.m. Central European Time, 10th of November 2020. On the left shows the world map of affected countries, and the chart on the right shows you the distribution of new cases this week by 6 geographic regions. Each color represents the region on the legend. The orange color region, PAHO, is reporting majority of the cases. Africa in red bar accounts for 4% of the global cases. Majority of these cases are being reported from the Americas and European region. Below the world map, the figure shows you the distribution of COVID-19 cumulative cases and deaths, and it has recorded over 50 million confirmed cases of COVID-19, of which over 1.2 million have died, resulting in a case fatality rate of 2.5% from 219 countries and territories. So this slide illustrates the epidemiological situation of COVID-19 in Africa as on this day, 11th November, 9 a.m. East African time. And the curve shows the new COVID-19 cases reported daily by regions. The red line on the chart represents the 7 days moving average that indicates a continuous reported cases in 55 member states. The African figure shows over 1.9 million and over 1.9 million cases, 45,000 deaths, resulting in a case fatality rate of 2.4%, and over 1.6 million recoveries, of which 84% people have recovered from COVID-19 across the continent. During the month of October, there was a slight increase in the number of new cases being reported, signifying the second wave of cases being reported from the continent. So this table shows the cases, deaths, and recoveries in Africa, as well as across the regions. Over 10,000 new cases has been reported, and 245 new deaths, and over 9,000 recoveries were reported in the last 24 hours. Majority of these cases were reported from the northern region. The northern region is still reporting the highest case fatality rate, which results to 2.72%, followed by the southern region, which is higher than the Africa's case fatality rate. So this map of Africa shows the categories of member states reporting COVID-19 cases. On the left side are the 5 categories. You can see 22 countries are reporting less than 5,000 cases, 14 countries over 10,000 to 50,000 cases, 11 countries reporting over 5,000 to 10,000 cases, and 7 countries are reporting about 50,000 to 500,000 cases, and only 1 country, which is South Africa, has reported over 500,000 cases. So the map shows the cumulative COVID-19 incidents by African Union member states. There are 4 countries reporting less than 10 cases, 29 countries reporting 10 to 100 cases, 14 countries reporting from 101 to 500 cases, and 7 countries reporting over 500 cases per 100,000 population. And only 1 country, no data or information was shared, that's Tanzania. So if we look at the number of the new cases being reported for epidemiologic week 45, there are 4 countries, Libya, more than 5 countries, Libya, Tunisia, Morocco, Cabo Verde, and Botswana that are reporting the highest average daily cases by population. So with regards to testing, this graph illustrates the cumulative testing conducted in all African Union member states by regions. Over 90 million tests have been conducted across the continent, 10.3 tests per reported cases, and the overall positivity rate is 9.7%. The percentage increase is 4%. So the brown and red bar represents the new tests and new cases respectively, and the black moving line is the percentage positive. So lastly, this is the map of Africa showing the progressive progression of COVID-19 test per case ratio in 55 AU member states. 2 countries over 100 tests per case ratio, 10 countries within 31 to 100, and 27 countries within 10 to 30 tests per case ratio, and 16 countries below 10 tests per case ratio. In terms of the rate of tests per million population in member states, the minimum is 3.6, which is Sudan, and the maximum is 615.2, which is Mauritius. Thank you for your attention. Over to you.
Thank you very much, Chika, for that wonderful update on the current COVID situation in the region. Can you stop? Oh, thank you. Can you stop sharing your screen? Okay, thank you very much. So now we can move into the main agenda, which is the presentation by Dr. Wande. Dr. Wande, over to you.
Thank you very much, Yaya. I will just try to share my screen. Fantastic. So thank you very much. The outline of my brief discussion, because it's a very lengthy topic that the team has asked me to try to touch a bit to talk about. So I will be talking a bit about our recently launched One Health framework for National Public Health Institutes. And just for our member states representatives to better understand why we have come up with this framework, I will be breaking down some of the processes, some of the gaps identified, just talking a bit about NPHIs and what their function is. I will pull out one of the key goals in that document and touch a bit about other goals that this framework addresses. Right after, I will talk a bit about the capacity mapping that we are doing. And then finally, I will wrap up with the World Antimicrobial Awareness Week activities that Africa CDC has planned in collaboration with other technical partners. So quickly, this is just highlighting our team, our One Health team within the Africa Union and Africa CDC. It's a diverse group of people with relevant background needed to drive the One Health approach. The purpose of this One Health framework is to provide minimal objectives, propose certain activities, and give National Public Health Institutes some sort of guidance for them to adopt to address priority zoonotic diseases using a One Health approach. As a first step of the work that we are doing, this framework will guide National Public Health Institutes, similar public health institutions, and ministries of health on how to operationalize One Health activities, while simultaneously improving coordination efforts for prevention and control of priority zoonotic diseases in collaboration with other parts of the health sector. So what was the process for us in terms of developing this framework? When Africa CDC was set up, we identified One Health as a useful approach for us to embrace in addressing various public health threats. One area is zoonotic diseases. And as such, when we started to work on this framework, it was through an interactive consultative process with our African Union member states, experts across the One Health and zoonotic diseases field, international organizations, and other technical partners that support Africa CDC's work. We had a small group of technical working group with representatives from Africa CDC, US CDC, Chatham House, and FAO colleagues. When this framework was developed, we received feedback from member states through an electronic validation process, and went on to do 2 physical validation meetings. One was last year at the IONFI Congress, and another one at the One Health Forum meeting in Addis Ababa. So many would ask, like, why One Health? Why National Public Health Institutes? One thing that we always like to say at Africa CDC, that it is our goal to ensure that all member states have capacity to adequately respond to public health threats. And as such, we are working with member states to develop national level institutions that can lead and coordinate public health functions, which include surveillance, emergency preparedness, response, and public health research. IONFO, which I referred to earlier, is the International Association of National Public Health Institutes, defines NPHI as a science-based organization or network of organizations that provides national leadership and expertise to efforts to achieve substantive and long-term improvement in public health. We can all agree that National Health Institutes can drive this One Health agenda. And there are various One Health, various models of National Public Health Institutes across our continent. We have some represented as a single entity for fundamental public health, and some models use several government agencies responsible for various public health functions by creating a network or a platform to improve coordination and leverage scarce resources. This is just an overview of national public health establishments across Africa as of March 2019. The colors you can see in green are the fully established National Public Health Institutes, about 14 of them, and in progress, about 20 countries which we are working with to establish their National Public Health Institute or similar public health institution. We have over 20 countries across the continent that still need more engagement to drive the process of National Public Health Institutes. One of the unique roles that National Public Health Institutes can play in the One Health rationale is working together with to address complex health threats at the human, animal, and environment interface. Global health systems improved in a sustainable way need an efficient prevention of global health risk. So there's a need to have a sustainable system that has representatives of all these key sectors. This document is the recently launched tripartite guide to addressing zoonotic diseases in countries, which this framework highlights some of the useful tools that member states can adopt to strengthen their national capacity. So like I mentioned, One Health is, especially when it comes to addressing priority zoonotic diseases, has various sort of interfaces. One of them is having a multi-sectorial One Health coordination mechanism, which is something that we at Africa CDC are advocating for. There's a need to have, for countries to have MCMs for zoonotic diseases, such that there's a sort of formalized or standing group to ensure that there's collaboration, communication, and coordination across all sectors responsible for addressing zoonotic diseases and other health issues across the human, animal, and environment interface. There's a need for this MCM to have routine, ongoing functions and responsibility for coordination, leadership, and governance of effort amongst all of these relevant sectors. Across various countries, we have seen many countries already having some sort of multi-sectorial One Health coordination mechanisms. However, some countries have these mechanisms but do not have representation of the Ministries of Health or the National Public Health Institute. Or sometimes they do have representation, but the MPHIs are not fully engaged in working together with the MCMs to address zoonotic diseases and other One Health challenges. In this document, we highlight some examples that are existing across the continent: National One Health platforms, zoonotic disease units. Some refer to them as IHR group or the One Health group. We encourage national public health to work with the relevant sectors to ensuring that there's a formalized multi-sectorial One Health coordination mechanism in country. This map just highlights some countries that already have formalized multi-sectorial coordination mechanisms. As you can see in red, we have quite a number of countries with some sort of fully operational MCMs. And other countries with informal MCMs are highlighted in a bit of dark gray color, while the beige or light brown colors is we have no information about the MCM here. Now, this presents a unique opportunity. I'd like to pull up the potential benefit of having national multi-sectorial coordination mechanisms. Using COVID-19 response activity as an example, we highlight some of these countries that this multi-sectorial coordination mechanism has been able to leverage on the veterinary services and the veterinary laboratory capacity to support COVID-19 response activities. As you can see in this on this slide, we have highlighted some of the countries whereby the veterinary laboratory services are supporting COVID-19 testing. Some of them are supporting COVID-19 sample storage. Others are working in the health emergency operation centers and mobilizing COVID-19 responders. It's important for us to also see the potential on joint contact tracing through our community health workers and surveillance and quarantine officers trained to participate in this process. You can also see the potential benefit of having a multi-sectorial coordination mechanism whereby you're able to work together to prepare preparedness and response plans, also looking at national action plans for health security. So very quickly, I will just talk a bit about the One Health gaps addressed by this framework. Like I mentioned, this framework really looks at addressing gaps in One Health coordination and collaboration. We aim to support creation and strengthening of multi-sectorial One Health coordination mechanisms by ensuring that national public health and other stakeholders engage in formal MCMs. Secondly, we aim to support countries to develop and implement priority zoonotic disease prevention and control programs in collaboration with the MCMs. Now, National Public Health Institute and stakeholders will conduct and update their national zoonotic disease prioritization exercises using a One Health approach. And we will work with member states to ensure that these processes lead to the development of strategic plans for specific zoonotic diseases. We can all agree that there's an issue around gaps in data sharing. The key challenge is timely dissemination of information and data on priority zoonotic disease. This framework will support new and strengthen existing mechanisms for information and data sharing, which is with relevant One Health stakeholders for diseases such as rabies, zoonotic influenza, and at least 3 other additional priority zoonotic diseases relevant to each country. This will be done through established mechanisms for notification, such as the IHR and the OIE reporting mechanisms, developing data sharing protocol between all sectors, and developing interoperable tools. We move to gaps in zoonotic disease surveillance. As we, from various experiences, we can agree that uncoordinated zoonotic disease surveillance between relevant sector is a major challenge across our member states. This framework will provide guidance to countries on how to set up coordinated zoonotic disease surveillance between human, animal, and environmental health sectors. This will be done through indicator based. We will work with National Public Health Institutes to establish and strengthen indicator-based and event-based surveillance for priority zoonotic diseases. The highlight of other goals within this One Health framework would be looking to support assessment on the laboratory capacity and working with MPHIs to improve the infrastructure and the One Health workforce for laboratory capacity. We will work with countries to develop training materials and the capacity to test for rabies, zoonotic disease, zoonotic influenzas, and other priority zoonotic diseases. Conduct joint risk assessment for priority zoonotic diseases relevant to the national context. Also work in developing national preparedness and response plans using a One Health approach. And most importantly, creating a One Health training opportunity for technical staff within the MPHI. This document really, in summary, it creates opportunities for working for developing MCM structures inclusive of National Public Health Institutes. It gives some sort of authorities, it drives authorities to commit finances and human resources to supporting the One Health agenda and the One Health approach. There's a potential for presence of legal authority and policy frameworks to come out of this One Health approach. Countries can then develop operationalized research agendas, guidelines, and plans towards their One Health activities. There's a potential for legal authority and policy framework to be expanded to address other issues such as cross-border and regional efforts. In this document, we have created an assessment checklist just to help National Public Health Institutes and Ministries of Health to better understand their existing capacity and to measure progress in achieving the goals of this framework. The importance of the One Health assessment checklist is to measure and track progress of One Health implementation within the National Public Health Institutes in line with the 5 Africa CDC strategic pillar, that is surveillance and disease intelligence, information systems, lab systems and networks, preparedness and response, and public health research and institutes. This checklist will help us work with member states to identify the most pressing and urgent needs. It would help us track progress over time and also provide information to Africa CDC and RCCs to advocate for more resources to support ongoing development. Recently, we launched a One Health capacity survey tool. The reason for this is for us to have some baseline information about the needs of our member states. As such, we would kindly request representatives of this on this call to please access this survey tool and help us fill in the gaps that you have identified within your national context, as this will help us inform the support that we will be giving to member states over the next year. It would also help us inform key gaps that can be supported by the Africa CDC and the RCC. So this link will be shared in the chat. I will also share this link with Yaya to present. On that note, as you may be aware, and thank you to all the AMR focal points, which I already work very closely with, we are gearing towards the World Antimicrobial Awareness Week 2020. Just to reaffirm the One Health approach, we're doing this in collaboration with World Health Organization, AFRO and EMRO, OIE, FAO, and UNEP, that's UN Environmental Program. This is an Africa Union tripartite and UN event, and we will be having a series of events that looks across, that addresses issues on AMR in our African context. So these are the flyers. Please save the date. As you can see, we have listed some of the events that we would be having throughout this week. And this will be, we will kick off the week with the high-level panel discussion. As you can see, it's a rich lineup of regional directors cut across all of the institutions that I presented. I think this is really important because earlier this year, the heads of state and government committed to having the heads of state and government made a commitment at the AU Summit, what we call the Africa Common Position on AMR, where they reaffirmed their support to us technical agencies that we will work together to drive a change and to control AMR on our continent. On that note, I say thank you so much for being a part of this and for having me on this session. Over to you, Yaya.
Thank you very much, Dr. Wande, for that wonderful presentation, and I hope the participants has really grabbed the concept of the presentation. So, as Dr. Wande mentioned in her presentation, with regard to the One Health, where we need to harmonize the work of the animal health and human health and see how best we can support each other. So she also highlighted about how Ghana, Ethiopia, and other countries had been, the human and animal health has been supporting each other to help in the testing for this COVID-19. So I also saw it on the text. Namibia is also doing the same, where the veterinary lab is also supporting the human health lab as far as the testing for COVID-19 is concerned. So I thank you all very much. So the next item on the agenda is answer and question sessions. So if you have any question for Dr. Wande, she will happily answer your questions, whether it's regard to the presentation she made or whether it's regard to AMR in general or regard to the AMR week, which will be starting next week. So you can say your questions and she will be happy to answer. So if you are unable to mute yourself, you can type the questions in the chat box, then I will happily read them to her. So back to the participants. Any question for Dr. Wande? Some of our AMR focal points are also in attendance. So if you have any question or clarity that you want to make with regard to the upcoming the World Antimicrobial Awareness Week, WOW. So we will be very much happy to answer you. Dr. Watipaso, do you have any concern? Dr. Watipaso, can you hear me?
So yeah, I think if there are no questions, I think I don't know if our representative from Namibia, I think it will be a useful learning experience to us to just highlight how the working relationship of the veterinary labs supporting Namibia for COVID testing. Apologies that was not reflected on the slides, as we collected some sort of survey using an existing mechanism tool, so we were not able to pick up Namibia's veterinary labs in that survey tool that we launched. But it would be great to hear from the representative of Namibia just to touch a bit about what kind of testing is being done with the veterinary labs, and if possible, share a bit on the capacity of the vet testing that is being done. Over to you, Yaya.
Okay, thank you very much, Dr. Wande. I think that is a very great idea. And we have Dr. Ialo on the line who actually put it in the chat box. So, Dr. Ialo, can we hear from you?
Oh, good day, colleagues. Just for information, I'm not a doctor. I'm a field epidemiologist, registered nurse by profession. I've just shared it because we found it one of the innovative ways of coping with the, coping with the high demand. So the Central Veterinary Lab plus one lab which is private, and then we call it Namibia Poultry Farm, they came on board to support the COVID testing. And the testing that they are using is the same standard that is being done by the clinical labs. We don't have the public health lab yet, so we are having a parastatal company which is running the clinical lab and which is doing all the testing using the PCR and also doing the quality assurance for other labs, private labs that are coming on board, including the veterinary labs, being private or being state. Around capacities, the capacity, we can't really say that it's enough, because what has happened is the staff that is working in the veterinary lab, they have been pulled from their initial work to also accommodate the COVID testing. So there is a room for strengthening the capacities, both in the human-based lab and also the labs for the veterinary. That is all that I can share at this moment. Otherwise, I need to go back to the team and consult more. Thank you.
Thank you. I think that's fantastic. It will be helpful for you to please help us fill in the survey tool so that we better understand the needs across your country and how the work that we are doing we can prioritize supporting all of these activities. So I think I will keep encouraging our member states to please just complete that survey to help us support countries within this region.
Okay, thank you very much, Madam Ialo, for that enlightenment, and thank you very much, Dr. Wande. As she mentioned earlier, I'll be sending the survey questionnaires and the survey links. So we hope that you answer them. So another thing that I want to bring to your attention, this one is actually for Namibia. We've been working with Philomena, who's been serving as our focal point, our focal person, and also the NPHI focal person in Namibia. So Olivia is also, she is part of this meeting, and Olivia is the team lead for the Africa CDC volunteers that are based in Namibia. So I would want the two of you to collaborate and work together for the fact that we are both working for of course supporting Africa CDC. Because I remember the last time I was chatting with Olivia, I was talking to her about Philomena, but unfortunately they didn't know each other and they never meet. So this is a good opportunity actually to meet and discuss some of the activities that are going on in Namibia, which are being supported by Africa CDC. I thank you all. So the next agenda, which was a question and answer session, which is already done. Before we go to the closing remarks by our coordinator, Dr. Lul, if there is any other issue that that the participant will want to discuss with the RCC, feel free to bring it on. So if you have any other burning issues that you would want to discuss with the RCC, please feel free to bring it on. Our coordinator is online and he will be very much happy to answer all your questions or anything that you challenge through the RCC. So it means that no one is saying anything. So silence means consent. It means that there's no burning issue that you want to discuss with us. So on that note, I'm passing the baton to our coordinator, Dr. Lul, to give us his final remark and we can close today's echo session. Over to you, Dr. Lul.
Yes, good afternoon once again, ladies and gentlemen, dear colleagues. To begin, allow me to express my sincere gratitude to Dr. Wandi for the very, very wonderful presentations. And I also want to thank all our volunteers in the Southern Africa region for taking the time to listen to these important presentations. So before I close, I have some quick comments, not necessary for Dr. Wandi to provide the feedback now, but I think in the public health, we all working for one thing, to make our people live a healthy life that they truly desire and they can only imagine. So in public health, that's all our call. But at the end, we also work with many things in our life. There's so many competitions, even within health as a unit. So my one concern that I really need to bring up, that's vertical programs, they don't work. Because even in Ministry of Health, you will see there's a program for HIV, program for cholera, program for immunization. They're competing for the same results. But the most important reminder that even if you serve someone from cholera, he still may die from COVID, he still may die from HIV, he still can die from malaria. And that will give us that we need to have a real concept that addresses the human health as the one unit. And I think this concept of one health is very, very timely, especially in context of the COVID-19. We all have seen January, February this year, we're all looking to the China. Some country were laughing, some country were they don't know what they need to do. They thought one day it will not come to their country, the COVID-19. But late in July, it became obvious most of the countries in the globe, they all experienced the burdens and the magnitude of the COVID-19. We all remember in April when all the countries closed. And it was a disease that's came from animal to human being and then to the other countries. And that's why I think we need to reflect very, very deeply in public health, especially for those countries in Southern Africa region, especially you volunteers. I hope you have the minimum attitude to understand this important concept so you can be able to share it with the countries, slowly from bottom till when you reach into the ministers. I think that's the role that you need to do the advocacy at that level. But nevertheless, Dr. Wandi, the most important things will go back to African CDC at the headquarters because we are a centralized organization that most of the things is done at the central level. And one of our competitive advantages of African CDC, because it's a member state-owned health agency. So the African CDC leadership have access to the head of the state, have access to the Ministry of Health, have access to technical staff of the who are in charge of the Ministry of Health. And I think it's so important, so critical that the African CDC should take advantage for high-level advocacy, especially during the head of the state meetings, also during the head of during the Minister of Health meeting, to create side meetings specifically on how to advocate for these new concepts, because these new concepts is not on the ground. And where the African country works, We are top to bottom. We don't work from bottom up. So we need to make sure that we convince the ministers. We need to make sure that the ministers and their lead technical staff, they understand this concept, to have a, you know, to be able to move and also to be integrated into the health policy or into the health strategy and other things. That's critical. There will be no other way to make it pass quickly. Also, the second thing is also I need to emphasize that you need also to have a very simple framework that you can be also shared with the country so they can be able to see it quickly and present it and share it on those levels. That's where they will be interacting with the people. So third things that I want to raise is on Southern Africa from the slide number 10. I don't know if I read it correctly. You know, most countries in Africa, in Southern Africa, they were brown color. It's only South Africa, I believe, has some information available on One Health issue. And that's why I need to encourage our colleagues who are in Southern Africa member states to make sure that we collect the necessary information. Hopefully they will be on that survey tools that will be shared with you. So we will have at least the information about our countries. And those information will help us to design the strategy, will help us to design the advocacy tool for the member state to join, or to at least to have interest to listen to it. So with this, I want to thank all of you once again. And I want to also encourage our volunteers that today we had the meetings, and one of the issues that was discussed is some of the challenges that are being faced by the by African CDC volunteers in all the countries that are operating. But nevertheless, the African CDC director has committed next Tuesday to have a brief update on those challenges, starting from the contracts, from the challenges of transportation and logistics, and other issues that are being faced on the ground in supporting the African countries. So I ask on behalf of the African CDC leadership and RCC to be a little bit patient. The process of resolving some of those issues are in process, especially to contract and the salaries. Also in terms of some of those logistics, you know, especially with the vehicle hirings, the money that were used for hiring those vehicles were exhausted. They were using through the partner that was easy to access. But now those money, they were exhausted and then has been transferred into African Union procurement process, which is very also lengthy and will be time consuming. So the bottom line, we really need to be a bit patient, and also we need to have courage to do the work that we've been called to do, is to help our countries, to help our Ministry of Health, National Public Health Institute capacity, so they can be able to operate and function in a way they will improve the health of the people in those countries. With this, I thank you once again, and I wish you wonderful evenings, and hopefully we'll meet again. Thank you.
Thank you very much, Dr. Lul, for that wonderful closing remark. So for that being the case, the meeting is adjourned until in the next 2 weeks. And thank you all very much for your time, for joining on today's sessions. I thank you all.
Thank you.